My name is Durham Wong Rieger, and I have the extreme honor of being the chair of the Rare Diseases International, as you know, our National Alliance of Rare Disease Organizations, here to actually bring for you a very short but very, very jam-packed hour on looking at why a UN resolution on rare diseases, and especially as we say, why now? Very much so in this year in which, of course, we're all up against so many challenges. And I think as rare diseases, we feel those challenges as much and maybe even more than many of the other populations that are affected. So for us, it is the opportunity on Rare Disease Day to bring together our global community. And certainly it's the global community that's brought us to this point. It's the global community that has been so much responsible for all the achievements we have been able to make with regard to our global partners, and especially with regard to advancing the recognition, the awareness, and we know now many of the actions toward providing equity for people, persons living with rare diseases. And this event actually represents probably one of the culminations of what is this year, the Rare Disease Day in terms of equity for all persons, and meaning equity for people living with rare diseases relative to all other diseases, relative to all other persons, but especially for us as well, equity for people living with rare diseases across the globe, because we in the rare diseases community are not exempt from, I think, having inequities within our own community, where in fact some countries, some jurisdictions are able to move faster and able to have more than others, and where persons who are living with rare diseases are in fact experiencing disparities because of where they live, because of the kind of circumstances that they are in that are not necessarily related to their rare disease. So this is our opportunity also to make sure that we live as a rare disease community, what we call for from others, and that is ensuring that everyone with a rare disease, that no one with a rare disease is left behind. So this is a very important event to us, and it's certainly a great opportunity for us to do this in partnership with probably our two leading partners within the community, and that is EURORDIS. As we all know, RDI is actually a child of EURORDIS and really grew out of the recognition that EURORDIS was doing an amazing job in terms of covering and supporting rare diseases right across Europe at the policy level, at the state level, certainly at the clinical and the treatment level, research level, but increasingly was also serving for the world, and recognizing that we needed two things. One is to acknowledge that the European and the European Union still had a lot of issues that they were going to have to continue to advance as the European Union, as European states, but also that there was a need to have a global entity. And so this was a very important conversation. And we bring this event together, though, with our other very important partner, and that is with the NGO Committee for Rare Diseases. And this, again, was something that would come forth in partnership and was the great opportunity for us to be able to recognize the many stakeholders that are available there. And in a few minutes, you will hear a bit later from Anders Olsson, who is the chair of our NGO Committee for Rare Diseases, and also along with Jan Lekam at EURORDIS, has been really responsible for, I think, moving rare diseases into the global stage, and certainly on behalf of the patient community. So there is an urgency for us to bring forth this UN resolution for rare diseases. It's an urgency within this time of COVID, but it's also an urgency within our own community. So we ask everybody to join us in celebration of Rare Disease Day and our call for equity, but also to help us move forward using this theme right across the globe, across all stakeholders, and on that global stage at the United Nations. So we're going to pivot very quickly to looking at the official Rare Disease Day video.
I am Tristan.
Angelina.
Nama saya Syafiq.
Regina.
Habari asubuhi, Javi.
Jeg er Jon Christian, og jeg bor i Norge.
I live in the United States of America.
In Australia.
Malaysia.
No Brasil.
Tunaishi Kenya.
My passion is for fashion and design.
I love to dance.
Menyusur hutan.
para viajar e descobrir novas culturas.
Anapenda kunitazama nikipuliza mapovu.
Jeg elsker idrett og spiller spill med familien min. Minhas paixões são minha fuga quando as coisas estão difíceis.
Ada hari-harinya apabila melakukan perkara yang biasa akan jadi sangat susah.
When your disease makes you feel isolated.
It's difficult to walk.
Å være med på laget.
When I'm tired.
Afraid.
O controle da doença pode ser desafiador.
Atau mengecewakan bila saya kehilangan masa.
Muda muhimu sana.
But we learned to be resilient.
Para apreciar os pequenos detalhes que me trazem alegria.
Kumwona mtoto wangu wa kiume anavyofurahi tunapoenda nje, nikijua anasikiza hadithi na sauti zilizo karibu.
Mencari titik perhubungan dengan masyarakat yang tak pernah saya sedar wujud.
Å være uavhengig på grunn av menneskene rundt meg.
Their fierce support.
Sua bondade inabalável.
They're big love.
Mine venner.
Keluarga.
Enfermeiras.
Doctors.
Support workers.
Assistenter.
Mashirika ya wagonjwa.
Together, we are a strong community.
Nimeweza kuelekewa.
Histórias compartilhadas que me libertaram das dúvidas. Og ga meg selvtillit.
I am Tristan. I live with sickle cell.
I'm Angelina.
And she has CASC, a neurological disorder.
Saya Syafiq dan saya hidup dengan ectodermal dysplasia.
Regina, eu tinha leiomiosarcoma, câncer raro.
Huyu ni Harvey, ana SMA, spinal muscular atrophy.
Jon Christian og jeg har OI, medfødt benskjørhet. Esta é minha vida.
Suara saya.
And I am more than my disease.
We are rare.
Kami ramai.
Nós somos fortes.
And we are proud.
That was amazing. And hopefully you had a chance also to use the video or to have videos of your own in your own countries. Many of us are still doing Rare Disease Day events or Rare Disease Month events. And at the end of February, we here in Canada are going to be doing our Rare Disease Day conference, in fact, next week. So this is really a great timing. Really would like to again welcome everyone. I know there's some people that joined as we've been doing the video. So really, again, a warm welcome to everybody. And thank you so much for joining us on this very special Rare Disease Day event where we're uniting to call for a UN resolution on rare diseases. And as I said in the opening, we really feel that the time is right now in terms of calling for this resolution in the midst of a COVID-19 pandemic, in the midst of so many other economic, social challenges that we're all facing, recognizing that equity for rare diseases, as you saw in the video, is a priority, but that equity within the rare disease community is also something that we must strive for. And how do we treat each other with equity? We're so really proud of the rare disease community. And certainly, I think Rare Disease Day, as we look at the events that have taken place, truly has become probably one of the biggest global events among disease communities. So without much further ado, I'm going to turn to the floor over to Anders Olles. And all of you will know Anders from his many years of I was going to say devoted devotion to the rare disease community, but I think Anders recognizes that he gets as much from the community as he gives to it. But he's certainly one of our longstanding ambassadors and one of our hardest workers. Anders, along with Jan at EURORDIS, was chief among setting up the NGO Committee for Rare Diseases within the United Nations. So very appropriate that we turn this over to Anders to ask us to talk about the UN resolution and what it is that we're hoping to achieve with it, how it fits in with what we're doing now. Anders, over to you.
Thank you, Duran. Thank you for your kind words. And I must be very old, but I don't feel old, so probably I will do anyhow. So, dear friends all around the world, today we truly look at our community as a global community. Rare diseases have, of course, always existed throughout the world and in every country, but we haven't always been connected into common work. We have discovered that the impact of having a rare disease is the same regardless where on earth you live. And we also meet the same holistic impact the rare disease have on our lives. We call it the Big Five. That is healthcare, social care, school, insurance, and labor. This experience on how it is worldwide showed us urgent need to form a common ground from which we could work. Parallel to this, we also saw that the UN agenda 2030 for Sustainable Development Goals, the 17 SDGs. Let me come back to the true impact of having a rare disease. Having a rare disease influences all areas of your life, not only your health, but also your social life, your child's condition to perform well in school, your financial situation, and not least your adult working life. It is the same message said in the 17 SDGs that the UN, together with all their member states, have agreed to work for. All prime ministers have signed and ratified the Agenda 2030 to integrate in their own country. With this, we looked in 2014 how we could create a platform to work through the UN system in order to make all efforts worldwide work together and to bring the 300 million persons worldwide who have a rare disease come together in one community. For this purpose, we, that is Sahlgrenska Foundation, EURORDIS, and RDI, Rare Disease International, founded the NGO Committee for Rare Diseases, CFRD. The reason we turned to the UN in New York was obvious, since a rare disease have a holistic impact on every person. So in 2016, we held the Global Gathering for Rare Diseases, the inauguration of the NGO Committee for Rare Diseases, under the patronage of Queen Sylvia of Sweden. On that day, representatives from various and important agencies in the UN system, representing what I mentioned as the Big Five, attended and made presentations supporting our vision of having an NGO Committee for Rare Diseases in connection to the UN in New York. They consolidated this understanding, the NGO Community and Funding Act of the Rare Diseases and the SDGs. We counted with the presence of officials then from Office of ECOSOC, UN Sustainable Development Solution Network, WHO Office of the United Nations in New York, UN Women, UN Department of Economic and Social Affairs, United Nations Development Program, International Rare Disease Research Consortium, the International Federation of Pharmaceutical Manufacturers, not to mention the representative from several member state missions at the UN. And last but not least, representatives from patient organizations from all corners of the globe. It was during this event the idea was taking shape that we need to form a resolution for our work in order to make everyone work together to influence the life of people living with a rare disease. Talking to the representatives from UN agencies in New York and from the 15 member states that co-hosted our second UN event in New York in 2019, the Rare Disease Day policy event at United Nations, encourage us to start to work in setting up a United Nations General Assembly resolution for people living with a rare disease. Of course, we have discussed how working with the WHO in the UN Geneva can bring important impact for people living with a rare disease, and that is why Rare Disease International has established close link with this agency. But when we speak about the situation of a person living with a rare disease, the message from all over the world is loud and clear. Persons who live with a rare disease are affected in all aspects of their life. That's why this knowledge has to be spread, developed, and implemented into all the different agencies in a holistic view within the United Nations. And they are all, as you all know, located in New York. We are now calling for the timely adoption of the UN resolution on persons living with a rare disease, because the time is now for global collaboration. We know that working together always brings better outcomes than everyone developing their own wheels in parallel. If we have learned anything from the pandemic COVID-19, is that together is the only way forward. We will hear more about this process we are proposing to make this a reality. Let me just add how very happy I am seeing more and more agencies, member states, and other partners support our ambition for a General Assembly United Nations resolution. They not only support our work, they also help us to develop the resolution and help us how to lead these words into practical actions. The resolution is for us both a door and a door opener. I really look forward to working with all of you in this globally innovative ambition. I hope that when we meet in Dubai at the World Expo in February 2022, we can celebrate the resolution and identify roads to travel to achieve its commitments. So I thank you very much, and God bless us all.
Thank you so much, Anders. And no, you're not so very old, but you do certainly bring in like a lot of history and a lot of wisdom to it. That was a very, very powerful statement in terms of why it is that we're working with the United Nations, what it brings to it, but also how everybody has been involved, certainly the rare disease community. And I've been watching people join as we've been speaking. And so a warm welcome again to people who have joined as we have begun. I also really appreciate people who are joining, have been sending us just a little note of where they're from. So it's been wonderful to watch the bottom of the screen and see all of the different representatives in all the different countries. I almost want to stop as you're putting them on to wave and say hello to you, but really a huge hello to each and every one of you. Love to see your personal comment in there as well. Anders has really given us a lot in terms of understanding why it's important that rare diseases are part of the United Nations SDG. And now I'm going to ask Flaminia Makia, who is our Executive Director. I don't know if this is the first Rare Disease Day event in which we've had the opportunity to have, well, it's the first Rare Disease Day event. I don't know if it's the first if it's the first RDI event in which we've had Flaminia been able to address us as the Executive Director, but we are so very delighted that she has taken on this role, has been with us brilliantly in terms of working along with many of our other leads in terms of bringing this together. So Flaminia is going to tell us briefly what is in, or what are the key asks, not the whole resolution, in this UN resolution for rare diseases, understanding specifically what we're calling for. So Flaminia, over to you.
Thank you very much, Doreen. Thank you very much. The rare disease community, represented by RDI, the NGO Committee for Rare Diseases, EURORDIS, and all our members, is calling for a UN resolution made of 5 key asks and consistent with the range of existing initiatives, policies, and declarations in different areas. We have detailed the main areas of relevance in the preambular paragraphs. These areas are protection of human rights, fight against stigma, discrimination, exclusion, and marginalization, disability, vulnerability, rights of children and rights of women, universal health coverage, Agenda 2030, the Sustainable Development Goals, and the commitment to leave no one behind. Social inclusion. The key asks, as detailed in the operative paragraphs, cover human rights and inclusion, appropriate care, national measures to leave no one behind, inclusion in the UN system, monitor progress and implementation. So under key ask 1, human rights and inclusion, we encourage member states to uphold the human rights of all persons, including persons living with the rare disease. We encourage member states to address the root causes of discrimination against persons living with the rare disease, also through dissemination of accurate information and awareness-raising activities, such as proclaiming the last day of February as the annual Global Rare Disease Day. We encourage member states to collect, compile, and disseminate specific disaggregated data on persons with rare diseases to identify patterns of discrimination and assess progress towards improving their status. Key ask 2, appropriate care, covers the UHC commitments and international cooperation. So we urge member states to strengthen efforts to address the challenges of persons living with the rare disease within universal health coverage. We encourage member states, the UN system and other stakeholders to support the networking of experts and centers of care globally, so to strengthen healthcare systems and facilitate access to diagnosis and holistic care. We encourage member states, the UN system and other stakeholders to strengthen international collaboration and coordination of research efforts, as well as sharing data on rare diseases. Under Kiosk 3, national measures to leave no one behind, we encourage member states to adopt and develop national strategies, plans, legislations on the rights of persons living with the rare disease, to adopt and develop policies and measures to address the social development challenges faced by persons with rare diseases who may need specific assistance to access benefits and services and promote their participation in society. We urge member states to implement national measures to ensure persons living with the rare disease are not left behind, recognizing that they are often disproportionately affected by poverty and discrimination. We urge member states to implement national measures to commit working towards social integration, as well as mental and physical well-being. Kiosk 4, inclusion in the UN system, is mainly addressed to the UN agencies and programs. We urge member states, UN agencies, and other relevant international and regional organizations to make a concerted effort within the existing resources to include persons living with the rare disease in the monitoring and evaluation of the Sustainable Development Goals, and in particular, SDG 1 on poverty, SDG 3 on health, SDG 4 on education, SDG 5 on gender equality, SDG 8 on decent work for all, SDG 9 on innovation, and SDG 10 on reduced inequalities. Indeed, to address the multifactorial challenges of persons living with the rare disease, we need actions in different areas of development. So we encourage member states, the UN system, and other stakeholders to foster international cooperation and improve coordination to advance an inclusive Global Agenda 2030. We encourage member states, the UN system, and other stakeholders to facilitate sharing of information, practices, tools, and resources that are inclusive and accessible to persons living with a rare disease. Kiosk 5, monitor progress and implementation, is addressed to the Secretary General. We ask to the Secretary General to present a report to the General Assembly on the various social development challenges faced by persons living with the rare disease, with recommendation for further actions to be taken to address identified challenges. We encourage the Secretary General to collect information from member states and all relevant bodies of the UN system, as well as from civil society, in preparation of the report. And finally, we ask the UN General Assembly to consider the issue of persons living with the rare disease as part of their agenda under the specific item, social development. Thank you very much.
Thank you so very much, Flaminia, and huge thanks, I'm sure, to the entire team for having put together such a comprehensive resolution. As you can see, it touches on all the areas of the UN SDGs, and hopefully, we can see that hopefully all of the other member states and the agencies there can see why rare diseases deserves to be in there and how it really is important in terms of including the rare diseases. But I think as importantly, as having a global resolution, as having calling upon these global agencies to call on their member states to open up doors, or at least to put up the doors. I'm not sure that this will open the doors, but at least we'll have doors that we can knock on in order to further what we know needs to happen. Because as you know, the brilliance of the rare disease community is that it is made up of people. It's made up of people on the ground. It's made up of patient organizations on the ground. It's made up of patients and parents. It's made up of institutions that all come together and support us. And all we are asking for is the opportunity to have some of these doors and have some of these initiatives that we can go to and be able to exert our own influence and be able to put together our own kinds of initiatives. We're not asking anybody to do anything for us. We're asking for the opportunity to do and to be welcome and to have these kinds of opportunities to actually see it executed. So brilliantly done, both in terms of the why and also the absolutely what needs to be done. And really to demonstrate, I think, a bit of the strength of where our community is, we're going to present to you a few of the patient representatives from our, not from our core group of countries that are supporting the resolution, but from others as well, who will talk to us about why they see the importance of a UN resolution and what it means to them on the ground. So I think we'll turn it over to, I think we've got 3 specific presentations, one from Lisa Foster from New Zealand, another from William and Malta, who's going to be speaking to us live, and then one from Rosalind and Christine together from Kenya, who will give us a bit of a video as well as maybe something live. So our slides, I'm going to turn it over, I think, to start with Lisa.
My name is Lisa Foster and I'm the Chief Executive for Rare Disorders New Zealand. My interest in rare disorders came from my background in biomedical science and a desire to learn more about the sector following some challenges with my own son. And we as an organisation are the umbrella and peak body in New Zealand for all people living with a rare disorder and their families. Our collective, we represent our collective and we amplify their voice. We unite efforts to improve health outcomes, to advocate for positive change when they face barriers. We aim to help direct them in the right place to overcome those barriers in whatever area that may be.
My name is James and I'm the chair of Rare Disorders New Zealand. And I became involved just a couple of years ago when I was hospitalised due to complications from Fabry's disease, which was something which affects a number of people in my family. And through that experience, I came in contact with Rare Disorders New Zealand and realised that there was a lot of important work to do to make sure that our community wasn't ignored, that we were visible, and that we could begin creating some positive change, as Lisa has pointed out.
The challenges that are faced by people with rare diseases in New Zealand are exceptional in the sense that we do not have a framework. We do not have policy which would help to create pathways. So we are starting with looking for recognition as a priority, public health and social support. In order to do that, it would be helpful for us to have a UN resolution on rare diseases that would help us with our advocacy campaign, and it would help us to explain the significance of the exceptional barriers that face this vulnerable population in so many aspects of their life. That would include access to educational support for their children, access to diagnosis, access to medicine, access to social supports, including mental health, and access to wider disability support. Often when you have a rare disease, it's invisible. And unfortunately, without clear recognition at a policy and government level, that makes the mechanisms and the pathways very difficult to navigate.
So living with a rare disease is often lonely and isolating on top of the health concerns that you have. And for many of us, it's outwardly invisible. And because we're not easy to see, it feels as though we're easy to ignore. And I think as a patient, you know, it often feels that it's too easy for the system to simply ignore your presence because it's rare, even though the shared experience of those with rare disorders is relatively common. So I've experienced that personally, and I've heard it time and again from other patients and caregivers in our community. And while individual healthcare workers are concerned and they're empathetic and they're supportive, often at a structural level, you feel as though your issues are ignored. And when you're already facing health challenges, that can compound other issues such as mental health issues and social issues. I know a lot of, in my case, I run a business, and I know a lot of other people are often worried about employment. They're worried about the impact on their families. And, you know, this situation where the experience of people with a rare disorder are ignored is really well demonstrated by the lack of a national framework for rare disorders in New Zealand. And it speaks to that lack of recognition of that lived experience of thousands of Kiwis. You know, for me, the impact of the UN resolution would be incredibly important because it kind of sets an example for the country, our country as a whole. And it kind of creates a direction and says, this is where the international community is at. And, you know, this is where we should be heading as a nation in terms of the care, the support, the health journey of thousands of our own citizens. And so it's really about that ability to recognise the issue, recognise the scale of the issue, and that it is crucially important from the equity point of view.
Brilliant. Thank you so very much. I think we're going to pivot very quickly then to William from Malta. I think you're with us live here.
Yes, I am. Let me share my screen. Okay, thank you for having me. Michelle Muscat is unable to do the presentation today because she actually has COVID, and the last couple of days she hasn't been feeling too well. So I'm going to do her presentation on her behalf. So Malta, there's an estimated 30,000 people who suffer from a rare disease. Our door-to-door visits revealed that people in Malta with a rare disease and conditions were living in isolation with no voice, no real or proper diagnosis, no medication, no cure, no support systems, and no real understanding of what a person goes through. And even though Malta is very small, we experience the same challenges as every other country. And hence, we launched the National Alliance for Rare Disease Support in 2015. Our purpose is to speak on, basically provide a stronger voice than a single rare disease support group. Our mission is to bring together all the stakeholders, which include patients and their relatives, researchers, medical professionals, and other organizations representing a specific cause. We have a number of educational, informational meetings, networking events, free social counseling and therapy. We're working on setting up a second office on our sister island. We do an annual commemorative mass. We have a number of awareness campaigns through hospitals, TV programs, and social media. We work with the University of Malta Biobank and do an annual rare disease curriculum where we bring scientists, policymakers, and health professionals together. And of course, we do a number of annual fundraising campaigns. We've lobbied with government and the health authorities to create a national registry for rare diseases, which was launched in 2016. We've lobbied to provide access to rare disease patients with exceptional need for treatment. We've lobbied concerning disability assessment reform. We've lobbied for cross-border healthcare reimbursement of treatment in any EU country. We're currently working with the health authorities for early COVID vaccination and inclusion in government rollout plans. At the UN resolution level, that would give us our cause moral authority. The General Assembly of the UN has been at the forefront, pushing ahead aspirations of different yet equal people around the world. Rare disease affect each and every country. The isolation, the loneliness, the challenges faced by people with a rare disease and condition and their families do not discriminate based on nationality, size, or characteristics. The UN General Assembly in 2015 adopted Agenda 2030, outlining the Sustainable Development Goals and striving on leaving no one behind. And who else is more left behind right now than patients, rare disease patients and who have diseases, conditions, and their families. So looking at the positive effects of the General Assembly resolutions have on other areas such as World Autism Awareness Day and International Sign Language, it's now time to use those same tried and tested methods to put our mission on the agenda of the UN. It's no secret that together we're stronger. That's why RDI was conceived, and this is proven time and again at the European level through EURORDIS. So from our end, the National Alliance for Rare Disease Support will work through relevant diplomatic channels while lobbying governments. So together with you, we can spearhead this effort, get this resolution, and give rare diseases the rightful global platform they deserve. Thank you.
Thank you so very much, William. That was brilliantly put. And I think we recognize that Malta is that epitome of what rare disease is all about. It's a small country, but when you're small, you actually end up doing a whole lot more than if you had a huge organization and a lot more people. But as a small group of dedicated workers and supporters, it's been amazing what you've achieved. And certainly we count on Malta to help us in terms of this international acceptance of the UN resolution, because you know how much it would mean, but it's also people and countries like Malta that got us over the top in terms of our previous universal health coverage. So huge thanks. All right, we're going to pivot very quickly then to Rosalind and Christine from Kenya, who I know are on, and we'll ask them to share their views in terms of what's happening in Kenya and the UN resolution.
Thank you, Jane. My name is Christine Mutana. I am a mother to 2 children with different rare conditions, namely MCM and ring 18 chromosome.
My name is Rosalind Odero. I have 2 children. One of them has Joubert syndrome. Together with Christine, we are co-founders of Rare Disorders Kenya. And the reason why we started this patient-led organization is so that we can start tackling some of the issues that we currently have in Kenya. So currently in Kenya, we lack a definition of what is a rare disease. We do not have data of how many people are living with rare disease, what kind of rare diseases are there. So that is left for support groups and organizations like us to sort of start collecting that data one by one. There's no framework as to address issues to rare diseases. In terms of priority in the government, in terms of the healthcare system, I think we're really lower at the end if we are even in that list. We have different challenges currently with rare disease healthcare. We have misdiagnosis and delayed treatment, mostly due to the fact that doctors do not know about rare diseases or their existence in the first place. We have inadequate specialized healthcare providers, such as genetic counselors who can be able to assist in the treatment, or rather in the identifying of some of these diseases. There is lack of access of treatment and care. People have to travel a long distance just to come to the city or to the urban centers to see certain kind of doctors. There is also limited or non-existent treatment options that would be readily available. For example, if you look at a disease like Phenylketonuria, it's not yet known, this disease. We only have one family that has 2 children, and they are the only documented case currently in Kenya. There are high medical costs. Currently, 20% of the population is under health insurance, of which 11% is getting their insurance from the public sector. Unfortunately, those who have insurance from the private sector, it means that rare diseases are not covered because they're considered congenital or genetic. So even if you're lucky to have an insurance, it means that it is capped at a very low limit. And this means that people have to pay out of pocket for some of these medical costs. You rely on your friends and family. And if you have a rare disease, that means that you probably might need to go and see your doctor more often than the normal general population. It means that it pushes you lower under the poverty line. Priority is currently given to communicable diseases such as HIV, AIDS, TB, and malaria. Right now, NCDs are starting to be recognized, for example, diabetes and COPD, but a lot needs to be done. There's stigma and discrimination. Most people don't understand what rare diseases are, and given the nature of rare diseases where you have several children, possibly because of them being genetic, it means that people start thinking that either you are cursed or you're bewitched, and people start running away from you or don't want to associate themselves with you, leading to higher incidences of mental health issues and just feeling isolated more and more than normally you would have.
What the UN resolution would mean for us Kenyans, we would have awareness. This would reduce stigma in terms of the community would know that there is an existence of rare diseases and its effect on family members, hence would be more willing to learn more about it. It would also reduce the diagnosis odyssey from the doctors, such that we would have early intervention, early detection of rare diseases, hence early management, leading to advanced quality of life for the patient. Policies to be put in place so as to cater for people living with rare diseases so that they can be catered for in society. Another huge gain would be that we would get a national rare disease definition and also data research in terms of what does a rare disease constitute in Kenya. It would also be, this would also lead to a registry, which would also show the number of rare diseases and the types of rare diseases we have in the country. Last and definitely not the least, we would have universal health care. This will ensure that there's equity and affordable health care for persons living with rare diseases are considered and catered for in the country.
We urge you all to approve this resolution for all of us who are living with rare diseases. Thank you.
Thank you so very much to both Rosalind and Christine for that very powerful testimonial and the commitment to continue the work that they're doing. All we're asking again is the opportunity to have the kinds of policies and national supports that would enable people living with rare diseases to fully participate. So thank you very much. And thanks to all of you. And as you know, we have so many more people that are on our line right now. We could have pulled from any one of you that are in the audience right now to give those same kinds of I think, really strong messages on what you're doing and why a UN resolution. So huge thanks to Lisa, to William, and to Rosalind and Christine for bringing that forth in their own words. We're going to just now pivot to just getting some quotes from other high-level events that we've had at the UN, organized by the NGO Committee and by EURORDIS. There's a lot of support for this type of work that we're doing at the global level, at the WHO level. So I think we're just going to give you a bit of that. I think it's more of an inspiration than anything else, and a demonstration of the support that's already there.
We must keep in mind that our main goal should be that of Agenda 2030. That is the imperative of leaving no one behind, which by definition also includes leaving no person living with a rare disease behind.
The agenda and the goals remain a great source of optimism for countries and for people. The vision set out in the declaration is for a world free of fear and violence, of universal literacy, of equitable and universal access to quality education, healthcare, and social protection, where physical, mental, and social well-being are assured. It is anchored in the premise of leaving no one behind. And this is why the agenda is a beacon of hope for people with rare diseases and those who accompany them.
Rare diseases attract stigma and discrimination, and people living with a rare disease are excluded from participation in employment and from integrating into society properly. So what needs to be done to ensure respect for human rights for those persons living with a rare disease? And first and foremost would be to recognize and elevate the issue. And as long as rare diseases are not identified as a policy priority, we feel that efforts to address the gaps in treatment will remain marginal.
Why, we may ask, is it good that rare diseases would be a matter to be discussed also here in New York at the UN, and not only in the UN Specialized Agency for Health, the World Health Organization? In general, health systems are not adapted to rare diseases, and there is little public health policy to respond to their specific needs. Access to quality health care, overall social and medical support, effective liaison between hospitals and general practices, as well as professional and social integration, autonomy, and independence. People with rare diseases and their families would therefore benefit if health and social services would be much better linked.
The high level of complexity and low prevalence of rare diseases calls for a global approach involving well-coordinated actions at national and international level. It also requires combined efforts to promote research to improve early diagnosis and treatment.
Making sure that what the WHO is going to bring to the table next October, I believe, September, October, really includes sound policies about also rare diseases that are not only related and referred to health and rehabilitation and medical issues, but actually they should focus more on the social model as well. So whatever you do here when you talk about rare diseases, I would really encourage you to look at the 360 different facets of the life of a human being. What we're doing here is not so much talking about rare diseases, but actually you're helping member states to implement the 17 goals they agreed upon.
We must work together to ensure an equitable and affordable access to quality health services and medicines for everyone, especially people who are most in need, which also includes people living with rare diseases, among others, while ensuring that they do not face financial hardship or fall back into poverty because of their catastrophic medical expenses. This is in line with our commitment in the 2030 Agenda to leave no one behind.
Japan, as a country that has been supporting persons with rare diseases under our own universal health coverage system for more than half a century, we are grateful that the issue of rare diseases is gaining momentum as a key policy area at the United Nations. In that regard, we will not have achieved universal health coverage unless and until we ensure that persons with rare diseases are not left behind.
I want to assure you of one thing. I want to assure you of our commitment to leave no one behind in the state of Kuwait, especially those with disabilities and rare diseases, and to share with you our quest to significantly reduce the burdens of their everyday life, to prevent their discrimination and stigma, and to ensure to the best of our ability, their full enjoyment of their fundamental rights. We are, as a country, in favor of the policy direction that you are pursuing here at the United Nations, and we are in favor of the universal health care, and we are in favor of a resolution on rare diseases, and we will do all that we can to help.
Malta stands ready with you and with all member states to motivate others to come on board and work for this noble cause, so that truly no one would be left behind.
In terms of international response, the UAE fully supports elevating the issue of rare diseases on the UN's agenda. And I heard, we all heard the call for a resolution on rare diseases. And as a member state, we could ask the experts, give us something that we could work on as member states. Let us discuss it and see if it could be a standalone resolution. And all member states who are present here today would be more than happy to push this agenda forward.
Let's speed up the process together and erase the borders, opening thus our hearts and our minds. UN General Assembly resolution on rare diseases will be the first, but the most important step to finally do it.
Well, that was pretty amazing. It's the first time I've seen it together as a montage. Congratulations to the people at RDI for putting it together. If you're not inspired and motivated by that, I don't know that you were actually paying attention. This is amazing. So we do know, and it goes back to the question, why now? Why now is because we've got that kind of political support behind us, because we do know that people at very high levels within the United Nations have actually recognized the importance of such a resolution and are fully committed to it. And to help us kind of get that, I think, even further across, I am just really thrilled to be able to introduce what someone who is our true champion, within the WHO and the United Nations, Amenabdi, who is at the WHO Office of the United Nations Executive Director. I'm going to ask her to talk to us a bit about the relevance of addressing rare diseases at the UN level, talking about it from a global level and broadly beyond the health dimension, and certainly beyond just the WHO level, which has been such an asset to us. I turn the floor over to Ms. Nanabe.
Thank you. Good morning, Excellencies, friends and colleagues. It's such a pleasure to join you today here, albeit remotely, but it's an important conversation. And I have watched how the issue of rare diseases has been advancing in our conversations and in our actions over the last couple of years. So I think today we are at one important milestone, and this conversation must take us forward even more further. So we are at the moment almost 1 year since the onset of the COVID-19 pandemic, and we have come far in the response, in innovation and research for treatments. And now we are in early stages of vaccine rollout. This pandemic has really showed everyone the importance of investing in health, and also in ensuring that most vulnerable people, typically excluded from existing health system models, including those with rare diseases, have access to all health services they need. Today, we are discussing the UN resolution. Rare diseases have already made it to one important UN resolution where it is clearly mentioned, that is a political declaration on universal health coverage, which is clear. Health is a human right for everyone. And in order to fully achieve universal health coverage by 2030 and leave no one behind, we must reorient health policies and systems to prioritize most vulnerable throughout the course of life. While our attention is on COVID-19 today, we must also ensure that focus remains on other health priorities as well, and on the broader issue of strengthening health systems, adapting it to the new realities, and to building back better to the preparedness. Further to that, we must keep attention on sustainable development goals. For the universal health coverage, it is important, and universal health coverage is a cross-cutting issue for achieving sustainable development goals, but health of people at large is absolutely a precondition for achieving progress in any of these areas. According to recent reports, progress in many sustainable development goals have been uneven. Only between 1/3 and 1/2 of the world's population was able to obtain essential services prior to COVID. And as we know, COVID has worsened this situation and this reality, and service coverage, especially in low and middle income countries, remains well below coverage in welfare one. Vaccine inequity is one manifestation of this inequity, and rare diseases suffer the most in the circumstances. As we have said in the past, the vision of Sustainable Development Goals is a world in which no one is left behind, including people who suffer from rare diseases. Just because disease affects a small number of people, comparatively, doesn't make it irrelevant or less important than diseases that affect millions. With 300 to 350 million people affected worldwide and more than 7,000 different types of diseases known to date, rare diseases continue to represent absolutely a major challenge in public health that has largely been ignored. Consequently, this is a field in public health and research that would benefit from globally concerted action and international multilateral collaboration. COVID-19 presents many challenges to us, but also the opportunity to build back better. The pandemic has reinforced the existing evidence that investments in health have long-term returns, while underinvestment has potential large-scale social and economic implications. The COVID-19 pandemic can be the catalyst for reorienting national priorities towards stronger, more equitable health systems, which also adequately address needs of people with rare diseases. This must benefit people from rare diseases. I would like to reflect on why it is so important to ensure that rare diseases are part of the global conversation, as the impact is much broader than just physical health. One of my previous speakers has mentioned especially the social aspects, and there are many other aspects of rare diseases that we need to keep in mind. Rare diseases patients and their families are a particularly vulnerable group of citizens who experience scarcity of medical knowledge, difficulties in accessing adequate care, and high psychological burden, including isolation from the society due to rarity of their condition and the scattered expertise to address it. In general, we once again must admit that public health systems are not adapted to rare diseases, and there is little public health policies to respond to specific needs. Access to quality care, overall social and medical support, effective liaison between hospitals and general practices, as well as professional and social integration, autonomy and independence. Improving the infrastructure and increasing support to medical and psychosocial care for rare diseases could diminish the burden of diseases for many patients and their families. Health systems can benefit from what we know about rare diseases. And in line with our preparedness agenda, systems should be designed to be fit for the future and will therefore contribute to universal health coverage and achieving sustainable development goals. COVID-19 has highlighted both challenges and solutions to current models of care. Health systems are struggling to respond to a surge of new patients and maintain continuity of care. However, operating under strict containment measures which limit mobility of people and availability of resources has driven innovative solutions to supply chain and delivery system challenges and required communities to leverage technologies and new models of working, such as e-health. This has the potential to transform the way in which health systems are structured and operate in the future, and this will have impact on rare diseases as well. Will we be able to take these tools forward to pool expertise, research and development, to pool data, care facilities, and develop virtual centers of expertise? Could they help to bring together multidisciplinary competencies and skills to serve the specific medical, rehabilitative, and palliative needs of rare diseases patients? Would we be able to globally find innovative ways of financing such centers so that patients and their families will not fall into poverty because of out-of-pocket payments related to the care of their rare diseases? COVID-19 pandemic showed us that all of this can be done. As technologies are advancing, we are confident that we will see also some in vivo gene editing in medium time horizon. The global community can and certainly will learn from rare diseases. We are faced with the option of editing the human genome with ease and precision. Notwithstanding the potential of those applications to be beneficial to any one individual, unforeseen risks such as epigenetic and intergenerational effects cannot be ruled out. Determining the principles that should guide and govern the human genome editing will have global consequences for individuals, societies, and mankind altogether. While the COVID-19 pandemic has laid bare global inequities and serious gaps in even the most advanced health systems, we see an opportunity to do better in future. WHO stands committed to working with countries and strengthen health systems, not just to prepare for the next health emergency, but so that all people have access to health services they need, especially the most vulnerable, including those suffering from rare diseases. Global solidarity and multilateralism is important now more than ever. As member states are working to implement a political declaration on universal health coverage and strengthening their health systems in the wake of the pandemic, I am sure that the strategy to build better will help to increase attention to rare diseases globally, and UN resolution on rare diseases could be one such strong mechanism to take this agenda forward. WHO is looking forward to being on your side. I thank you for attention.
Oh my gosh, I cannot thank you enough, Ms. Nabdi, for those amazing words. It is, has been an amazing opportunity for RDI to partner with the WHO and to have the WHO so strongly invested in what we're doing. We know that you are, and as you have been saying, still up to your eyeballs, I'm sure, in terms of dealing with COVID, in terms of all the issues that are still to come, but your recognition of rare diseases in this time absolutely means a great deal to us, and also your ability to really succinctly place the relevance of rare diseases in everything you're doing, and the contributions back that rare diseases can make in this time are just amazing for us. We so much appreciate not only your words, but we know behind those words, the work that WHO is doing, not only for rare diseases, but certainly for everybody at this time. But we really count on your support as we're moving this resolution forward with the United Nations. So we cannot thank you enough for these words and for everything that you and the WHO are doing for us on rare diseases. Thank you for taking the time to speak to us and for such a really, really strong, powerful message. Much appreciated.
Thank you.
Okay, that was very powerful, and certainly I think it's, we say some of these things, but it sounds different when it comes from the executive director of the WHO at the United Nations. It will mean such a great bridge to us. And now we're going to pivot then very quickly to some of the other member states and to hear from them in terms of their endorsements and their supports. This is, again, as we know with the United Nations, it has to come from the member states. And I will say that we're, going to have a very quick montage. I'm not going to try to read everybody's names because that will take as long as the videos themselves. But I will say at the beginning of this, my salute to the team at RDI and EURORDIS and the work that they've been doing with their volunteers to actually make this happen, getting member states, getting the agencies and at the United Nations on side is not a trivial task. And I really appreciate and salute everything that you're doing. So let's hear from some of the other member states here. Thank you.
Firstly, I would like to thank the invitation to Brazil to co-sponsor the event in commemoration of the Rare Disease Day 2021, and we congratulate the dedication to this cause. It is a pleasure to take part in it with you. Rare Disease Day highlights the existence of such diseases and evokes the need to include people with rare diseases. We need to strengthen the concept of rare diseases, emphasizing the capacities of the vulnerable.
No Brasil, estimamos que cerca de 14 milhões de pessoas são afetadas com doenças raras.
In Brazil, we estimate that around 14 million people are affected by rare diseases. Since January 2019, those people have a representation within the ministry, which is the General Coordination of Persons with Rare Diseases of the National Secretariats of the Rights of Persons with Disabilities, created to guarantee rights, hear the needs, promote the advancement of legislation and inclusion towards that population. The creation of the coordination demonstrated that our governments recognizes that the rights of people living with rare diseases must be respected. Its great particularity is a comprehensive and human rights approach. The main competences of the coordination are identifying and proposing action towards the protection of the integrity of persons with rare diseases, as well as articulating measures with other public agencies and civil society. In 2020, the coordination adopted important measures in this context, such as a partnership with a Brazilian university to develop extension courses, learning objects, and inclusion on the rare diseases matter, and also a complaints channel at the Ombudsman for Human Rights to offer information and support for patients, families, caretakers from the country.
E apoio para pacientes, familiares e cuidadores de todo o país.
Another example in this field is the creation of the Inter-Ministerial Committee of Rare Diseases, with the participation of several ministries. It is a forum for articulation and alignment of policies on this issue among several government bodies. Our government is carefully watching over persons with rare diseases and their needs, acting so that they can live in visibility. These people are, with their singularities, also living in our society and deserve our attention.
Dear participants, I would like to sincerely thank the organizers of this event, Rare Diseases International, NGO Committee for Rare Diseases, and Rare Diseases Europe for their inspiring efforts towards improving the livelihoods of persons living with a rare disease. It is our honor and privilege for Brazil to join the core group and support the call for a UN resolution on rare diseases. The discussions related to rare diseases are multifaceted and have impacts in every aspect of society. We must also bear in mind that persons living with rare diseases, and sometimes even their families, face discrimination and stigma, and are often denied equitable access to health and to social and economic opportunities. Hence, addressing the specific circumstances of persons living with a rare disease is, above all, a matter of human rights that should be conducted with a global perspective, in line with the Sustainable Development Goals and Agenda 2030 for Sustainable Development. In that sense, calling for a UN resolution on this issue is not only timely, it is overdue. The Brazilian government, mindful of the topic's cross-cutting aspect, has recently reaffirmed its commitment to persons living with a rare disease by establishing an Inter-Ministerial Committee on Rare Diseases under the leadership of the Ministry for Women, Family and Human Rights. Moreover, to celebrate Rare Diseases Day, the Brazilian government promoted in February a series of online public dialogues with experts and members of civil society to discuss the current challenges faced by persons living with a rare disease, both in Brazil and around the world. While the COVID-19 pandemic has further aggravated the lives of the most vulnerable, including persons living with a rare disease, it has also shown the world the importance of global action and cooperation across borders. Therefore, presenting a non-controversial resolution on rare diseases at the United Nations could bring this issue to the broad attention, granting it the global relevance it deserves and fomenting action based on recognized scientific practices. In conclusion, Brazil is grateful for the opportunity to join your efforts in advancing the rights of persons living with a rare disease around the world and stands ready to collaborate with member states, international organizations, and civil society to improve this cause. Everyone matters, and now is the time to shed more light on the topic of rare diseases in the international arena. Thank you.
I'm so honored to be part of this event celebrating Rare Disease Day. The state of Qatar believes in a world in which no one is left behind. No disease is left untreated, and every patient deserves treatment and support, no matter their disease or where they live. We view rare diseases as a public health priority, and we have clear policy frameworks and strategies prioritizes to improve care for people affected by rare diseases. We are one of the few countries in the world to have a dedicated facility to treat this condition, the National Center for Rare Diseases in Doha. The center is exploring new ways of delivering better patient care, education, training, and research. Most importantly, the center is working to improve the lives of people living with rare diseases, not only in Qatar, but also in the region. People all over the world who live with rare diseases have been left behind during the COVID-19 pandemic. Creative solutions are needed to ensure the estimated 475 million people globally living with a rare disease have access to healthcare, whether there is a crisis or not. The State of Qatar reaffirms its commitment to support countries and the international community to address the need of those living with rare diseases.
Depuis toujours, la France est en pointe dans la lutte contre les maladies rares. Elle a été le premier pays en Europe à élaborer et mettre en œuvre un plan national concernant ces maladies. Cette journée internationale des maladies rares est l'occasion de rappeler que la France veille depuis des années à faire entendre aux Nations Unies la voix des 300 millions de personnes vivantes avec une telle maladie. Nous avons aussi parrainé en 2016 la création à l'ECOSOC du comité des ONG pour les maladies rares. Celui-ci œuvre depuis lors pour améliorer l'inclusion dans nos sociétés des personnes vivant avec ces maladies, alors qu'elles sont encore trop souvent stigmatisées. La France co-préside aussi le groupe des Amis de la couverture santé universelle. Elle s'est mobilisée à ce titre pour qu'un effort prioritaire soit fait pour y inclure les populations vivantes avec une maladie rare. Cet appel a été pris en compte dans la déclaration politique sur la couverture sanitaire universelle adoptée en septembre 2019. La France poursuivra cet effort que la crise de Covid-19 a rendu encore plus nécessaire. L'objectif de pouvoir vivre en bonne santé, qui figure parmi les objectifs du développement durable, doit s'appliquer à tous, et notamment à celles et ceux qu'une maladie rare rend plus vulnérables.
Excellencies, distinguished delegates, ladies and gentlemen, I would like to thank the organizers of today's event, Rare Diseases International and partners, for highlighting the important issue of rare diseases at the United Nations community and for giving me this opportunity to add Thailand's voice to the conversation. The last time I spoke on Rare Disease Day was in 2019 when I was co-facilitating the negotiations of the political declaration of the high-level meeting on universal health coverage. At that time, no one could have imagined how a pandemic would change the way of lives of every person around the world. The COVID-19 pandemic has reminded us once again on the need for countries to invest in strong, resilient, and agile health systems. Under the concept of USC, Thailand believes that all people must have access to health services, medicines, and treatment without discrimination and without exposing them to financial hardships. People diagnosed with rare diseases face difficulty even in accessing treatment and have to bear the high cost of medicines, with the exact reason of this treatment and medicine being so rare. We need to pay more attention to address the lack of knowledge and expertise and the absence of disaggregated data on rare diseases while fostering research and innovation in rare diseases. In October 2019, Thailand added the initial 24 rare but severe diseases of inherited metabolic disorder to our USC scheme. Government budget has been allocated to cover the cost of treatment and medication for patients with these 24 diseases. A committee on rare disease was also established under the National Health Security Office to develop measures to address challenges of managing rare diseases, such as coming up with the definition of rare diseases under domestic policies and laws, improvement of referral system and data sharing system, and building the capacity of medical personnel and institutions. For the next step, Thailand is working on expanding the USA scheme to screen newborn children for inherited metabolic disorder all over the country to be able to provide them with timely treatment. Achieving USA and leaving no one behind, including those with rare diseases, is a much broader agenda than health alone. It addresses the structural challenges of inequalities, discrimination, and social development as a whole. We also believe that government must join hands with civil society and other stakeholders in making this agenda a reality, as we all have a part to contribute in this effort to genuinely leave no one behind. With this, Thailand commends the initiative to propose a resolution on rare diseases at the United Nations in New York and looks forward to working with you all in the process to adopt this important resolution in the coming months. I thank you.
Dear friends, my name is Agustín Santos Maraver. I'm the Spanish ambassador at the United Nations. The 4th of March, we celebrate the Day of Rare Diseases. 300 million people, not a small number, suffered from rare diseases in our planet. And they don't have the same treatment and the same opportunities to be taken care, to have research on their diseases, to be treated with the equality that the rest of us. No, because they are divided in very different and difficult treatments, they have to be one by one taken care, and that complicates and makes it very difficult to try to tackle their illnesses. There are 3 big organizations that represent them: the International for Rare Diseases, the NGO Committee for Rare Diseases, and the European EURORDIS. The 3 of them are working to try to push forward a resolution at the United Nations that which try to focus on these rare diseases and try to find solutions for the problems. For us at the United Nations, this is a very important exercise, because if there's anything that will prove that we are advancing in the objectives of the Agenda 2030, will be the rare diseases and how we treat them. Because if we leave them behind, that would be a terrible message for all other circumstances or other special situations that also need to be tackled in a specific way. So please think about those 300 million people who need the social opportunities to have normal lives, a non-discriminatory education and access to work, health, treatment, care, and research for their own very specific illnesses, and support and help us to carry on with this resolution at the United Nations. Thank you very much.
Wonderful. And it's now my privilege to introduce live His Excellency Ambassador Tetsuya Kimura, the Economic, Social, and United Nations Management Affairs with the Permanent Mission of Japan, who will give us some brief comments with regard to the support from Japan. Welcome, Ambassador.
Thank you, Madam Chair. At the outset, I would like to express my deep appreciation to the organizers, co-hosts, and partners gathered here today for the RDI Rare Disease Day event. Japan achieved universal health coverage more than half a century ago, and in addition to that, the government has been conducting research projects on rare diseases for the purpose of promoting therapeutic research and subsidizing medical expenses for more than 40 years. In 2014, the National Diet of Japan passed the Rare Diseases Act, and measures are being further strengthened under our universal healthcare system. The government has been promoting the development of orphan drugs for rare diseases, and with the recent rise of new technologies, such as genome editing, iPS cells, nucleic acid medicine, and AI-based drug discovery, attempts to develop therapeutic drugs in Japan have become more active. I believe that it is very important that safe and effective drugs developed in this way be made available to patients in a sustainable manner without excessive economic burden. And in that connection, I would like to share some relevant efforts on universal health coverage or UHC in the UN context. In 2018, the group of Friends of UHC and Global Health was established as an informal platform for all UN member states here in New York. Through the group of friends, some 40 member states, facilitated by Thailand, Georgia, and Japan, have been actively advancing the UHC agenda. In September 2019, we held the UN General Assembly's high-level meeting on UHC and adopted the political declaration on UHC, which inter alia calls on international community to strengthen efforts to address rare diseases as part of universal health coverage. This call embodies the notion of no one left behind, the core principle of the SDGs, and underpin the concept of human security, which Japan fundamentally subscribes to. At the inaugural UHC Day event in December 2018, a representative from the rare diseases community shared their voices in the context of achieving UHC. Rare diseases group contributed greatly to sharpening the 2019 political declaration on UHC by reminding us to reiterate the need to bring together the voices of all stakeholders, including the rare diseases community. We will not have achieved universal health coverage unless and until we ensure that persons with rare diseases are not left behind. The group of friends is now building momentum towards the next high-level meeting on UHC to be held in September 2023, and will continue to work towards achieving UHC by 2030. In conclusion, I trust today's event will serve as a springboard to elevate the agenda of rare diseases and facilitate discussions on future actions to be taken in the context of the United Nations. I thank you.
And we thank you so very much. Certainly, Japan has been an amazing ally for the rare diseases community. Your support for the inclusion of rare diseases in the Declaration on Universal Health Coverage was tremendous. And certainly our inclusion in the gatherings that you have with the Friends of Universal Health Coverage have meant a great deal to us in terms of the work that we do. So thank you again for your ongoing support and certainly for those very powerful words. Thank you. We're going to now then have a very quick look at some of the Rare Disease Day events before we get to our final panel.
I are working here today is evidence of that.
Wonderful. Such a great opportunity. You know, we may not be the most powerful rare community in terms of disease communities, but we're definitely the most colorful. So it's such a pleasure to be within this community. It just makes you happy all the time. And now I'm going to move to our panel and ask them to unmute themselves and join us, because we're going to have a bit of dialogue among some of the people who are really instrumental in the rare disease community, in the global rare disease community. I would like to introduce, well, we'll have an opportunity to introduce each one of them. Todd Holland, who is with the Office of the High Commission for Human Rights. We're also going to be joined by Ava Daly, who is, among many things, with Retinitis International. We're also going to have with us Samuel Wafi, who is with the Rare Diseases in Ghana, and also Carmencita Padilla, who is with us with rare diseases in the Philippines. So we're going to open it up. I'm going to invite and have an opportunity to have us have a dialogue among the different panelists to talk a bit about why rare diseases is important in terms of the work that they're doing and how they're working with it, but also the impact of a UN resolution on persons living with rare diseases, and how addressing rare diseases at the UN level is going to make a difference in terms of the work that they're doing, and certainly in the opportunity of being able to leverage a resolution in their own country. So I would like to invite all four of these panelists to join us. And what I'm going to do is just maybe offer a question to each one of the panelists and a dialogue among them. Okay. A little bit of noise in the background. I'm trying to figure out what it is. Okay, that sounds good. All right, I'm going to start with Todd Holland with the Office of the High Commission for Human Rights. Welcome, and thank you so very much for taking the time to join us. What I'd like to maybe ask you is, it is certainly, your office is one of the most important in terms of promoting not only the rights, but also the empowerment of persons who are vulnerable and experiencing discrimination. So in your opinion, why do you feel it's beneficial to include persons living with rare diseases as a human rights priority at this time?
Well, first of all, I just wanted to say thanks for the invitation, and to point out to a large degree what you're doing today is an important exercise of rights. The freedom of association, the freedom of expression, and then the participation in decisions that are affecting you. And so in many ways, the three organizers of this event are taking the idea that rights are both a tool and a goal very seriously. Because I see the exercise of rights through every part of this organization. And it's very important because oftentimes I think we lose ourselves in, we really need to achieve the right to health. We need to end discrimination. But in reality, what we're talking about is we need to use the rights that are already existing in terms of these are legal obligations on each member state. And to a large degree, why the rare disease configuration is so important is that there isn't enough awareness. There isn't enough visibility for people to understand that this group of people, this community, are suffering human rights violations through the discrimination, through the stigma, through the lack of access to healthcare, through the lack of understanding of this community as people with disabilities, the lack of access to Social Security. It's really a very interesting phenomenon. And I think that the work that the organizations are doing to try to bring together the different groupings within rare diseases to begin a process of creating the understanding, the visibility, the education is very important. And that's why the relationship to the work in the United Nations is so critical, because it's a vehicle for you to remind those in different member states of their already existent obligations, but there isn't yet an understanding of how these rare diseases fit well within these categories that everyone speaks about. And so I think that the idea that you have in terms of pushing toward greater recognition through the General Assembly resolution, through the meetings in the United Nations, can help to create the type of consciousness that's necessary to take seriously really what's at the base of human rights, which is participating in decisions that affect one. Because in every country, the public policies that are created oftentimes are not really aware of how this impacts people with rare diseases. And so through these processes of creating greater visibility, of creating greater interaction with member states, you're laying the foundation for them to begin to interpret differently their pre-existing obligations in terms of human rights, to take into consideration those with rare diseases. And so I think it's really critical, the work that you're doing and how you're bringing in awareness to the international community through this persistent advocacy. And it's wonderful how you have the different national chapters working, because in the end, it's the different member states that need to integrate these concepts into these understandings into their own interpretations of their current obligations. So I congratulate you. And for us, it's always important for human rights to be on the side of those that have been left behind. Because human rights is about empowerment. It's about using your rights to change a dynamic that is currently existing that marginalizes a certain community. And so we're along for this process, and we do what we can to create that awareness relative to the importance of each and every individual having their rights and having those rights respected. And so I hope that gives you a general sense, and I look forward to participating in the conversation.
That not only gives us a general sense, it really does provide, I think, a huge, maybe a call to action for us. The notion of human rights being empowering, as opposed to something that we can fall upon. It really does go back to what I think we were saying earlier, right? It really gives the impetus for the community to actually take action. But it does also then gives you a direction which you can go. It opens up the doors, and it gives you, as we say, the rights to actually ask for it. I think for many people living with rare diseases, we don't necessarily understand that we have these rights. And so I think being able to have them embedded in a UN resolution and also having them endorsed by your office and the other agencies really does change it in terms of what we feel we can do. So it isn't just entitlement, as you say, it's an empowerment to action. So thank you very much for that. And yeah, we'll look forward to having a bit more of a dialogue on it. So I'm going to just further than that turn over to Ava. Ava Daly, many will know, is the head of the Retinitis International. Ava, you support persons living with retinal diseases across the globe. How do you think a UN resolution would be useful or could be used, as Todd was saying, by those where there are no policies for retinal disease or maybe rare diseases writ large?
Well, thank you, Duran, and thank you for asking me to speak today. For us in the retina community, a UN resolution would have a very significant and a far-reaching positive effect on our community, which is very underserved and very misunderstood. It's It's poorly understood in the general public, but also unfortunately by many policymakers at large, you know, at a regional level, at a national level, at a global level. So like most other rare diseases, you know, we are linked by the SDGs really under aging, youth, disability, access to healthcare, as well as the human rights issue. But the specific needs of our community in the inherited retinal degeneration community and the rare eye disease space are not prioritized. So we believe any collaborative, you know, international effort can only drive the processes for national and regional implementation of policies, ensuring management of treatment and rehabilitation interventions, which are very important for our community, but also for the spectrum of rare diseases. And in particular for us in the rare eye community and the retinal community, you know, the main cause of blindness really among children, young people, and those in working ages in many regions are these rare eye diseases and these rare retinal diseases. And because of vision not being a priority in this space, it's really essential that not only the vision community works with a united voice together, but also adds its voice to this community of rare diseases, where in fact, so many patients with rare eye disease have found a home. And that recognition of its collective needs, which in so many cases are exactly the same. But it's interesting listening to the previous speakers talk about genes and genetics, because if my community, if the Retina International community could pick one thing that they would say really needs prioritization, it would be access to a diagnosis, but also to include genetic testing and genetic counseling in that process. 80% of rare diseases are genetic in origin, and for those affected with inherited retinal degenerations, there are over 300 genes involved. So access to a genetic diagnosis is really critical to understand the pathway of disease, its prognosis, how it's going to affect your life, the choices that you need to make, you know, and the care pathways that are relevant to you and will support your needs. But access to genetic testing is not equitable, even in countries that we consider to be the developed countries, the richer countries. It's not equitable, and the processes are incredibly different from country to country. So you can imagine in the developing countries, you know, there is no access. And if you're lucky enough to be able to navigate very complex, unwieldy systems, you know, they're not available at all to you, and nor is genetic counseling. So these people are being left behind currently. But it's not just the case in inherited retinal degenerations. It really is the case, you know, it runs right through the spectrum of rare diseases, as so many things do. So access to a diagnosis really is the biggest hurdle for people living with rare diseases. You know, where can you go without a diagnosis? You lose out, you're left behind. Patients need a diagnosis, as we said, for a prognosis, for access to the support and treatment, you know, but also as a conduit, as a way towards the proper systems of education that can support them, but also to leisure and to future employment. It's really fundamental, and it affects everything else. The lack of a diagnosis has impact on mental health, on anxiety, and it further exacerbates already complex conditions. You know, well-being is also a very critical issue. And it affects us enormously. So access to education, employment, as we say, these are the challenges that have a major impact on people living with rare retinal diseases, as they do for people living with other rare diseases. But the financial burden on families affected by IORDs, which are inherited retinal degenerations, are shattering and life-altering. And I've heard some stories this past Rare Disease Week across all of the disease areas where that has become such a critical area for people, and that lessens people's quality of life and disempowers them. You know, and like all rare diseases, you know, there is a disproportionate effect on women who must often give up their work to support children, you know, who have a rare disease, or oftentimes, as we've even heard today, multiple rare diseases. And this is also the case in our retina and rare eye disease community. You know, there is a little support for these women, and it's very important to mention that women who provide care are being left behind. The stigma of rare diseases has also been mentioned today, and it's a critical area that we must all be aware of. The stigma of sight loss for young people in particular affected by inherited retinal degenerations and rare, you know, really affects them psychologically, socially, culturally, economically, and they face discrimination and very specific challenges in education and future employment and those leisure activities, those social contacts that are so critically important in any person's development right the way through their childhood, their teenage years into adulthood. We must remember that children with rare diseases They grow up with those diseases. They don't grow out of those diseases. And it's a friend of mine always who has a grown-up child with a rare disease. She's 37, she's no longer a child. She's grown up with that disease. The services are needed. So the responsibility of organizations like the United Nations to set these resolutions, to ensure the convergence of effort and have a measurable and tangible outcome is critically important. You know, I've been saying all week, we've landed on Mars. We've landed on Mars as a society. Surely now we can really focus on the lives of people living with rare diseases and make sure that they're included in society with full participation. So this resolution will go a long way towards addressing a lot of unmet needs in this community. And, you know, I'm very happy that our community is participant in it and will continue to be so.
Well, I can see that you're going to be an ardent supporter, and they absolutely count on you to actually be able to bring in not only, as you say, your members in your member state. That was a powerful statement in terms of all the ways in which a resolution that addresses rare diseases as a human right can actually help us. I'm going to pivot then over to Samuel Wefe, who is, I still think of as a little bit of a newcomer who exploded onto the rare disease scene from Rare Disease Ghana. Samuel, you have, you know, you're a real champion for rare diseases, really in a country in Ghana which has universal health coverage, but certainly limited awareness of rare disease. So how would a UN resolution give specific assistance to you in your work in Ghana?
Yeah, thank you. Thank you so much for Dohan and the organizers for giving me the opportunity to share my knowledge on this issue. Basically, a UN resolution is going to help in bridging the gaps in access to health and social services for persons living with rare diseases, as there is a huge disparity in access. Ghana as a country has a policy, recently published a national health policy, and have few policies that seem to support non-communicable diseases to some extent. But the policy would, a resolution will help to ensure that in terms of the implementation of these policies and these frameworks, rare diseases are not neglected or are not ruled out. As a country that is struggling with a double burden of diseases, with a high level of infectious diseases and the growing burden of non-communicable diseases with the cancers, diabetes and stroke and kidney diseases and so many other conditions which are also on the rise. There's a high, and with limited resources, there's a high possibility that policy makers and implementers would have to prioritize in terms of where to focus resources. And it is very likely that they may neglect rare diseases in this in the process. So a policy would help, the resolution will help to ensure that rare diseases are factored in the implementation of the policy. It also will ensure that there isn't disparity in the access to healthcare. Ghana, like most developing countries, which has already been mentioned or highlighted by Christine and Rosalind in their presentation, face a huge disparity in access to resources that are needed to manage rare diseases. And so it's not any different from Ghana. Getting access to genetics services is largely missing, or it's difficult to get access, and having access to treatments is extremely difficult for patients who have access to treatment, and there's a lack of data which affects the definition of what rare diseases are. We are very lucky to be able to get the FDA through the publication of the guideline for registration of orphan drugs to mention rare diseases in there, but that's the only government document that we can actually pull out that has rare diseases in it. And so there isn't a consensus in terms of definition of rare diseases within our setting, which affects policies and affects the policies and the frameworks which are developed in the country. Also, the general awareness of rare diseases, and I've done a lot of engagement with various stakeholders, and it's still, they keep asking what are rare diseases and do they even exist, even though since we started from 2017 to date, we've recorded over 50 different rare diseases and supporting more than 50 families, and we keep showing this evidence, but it's still something difficult to believe that you can actually have a patient with progeria in Ghana, or you can have a patient with mucous polysaccharidosis in Ghana. It's still something which is very, very difficult to believe. But
I'm going to interrupt you for a second there, Sammy, because I just want to make sure we pivot over to Carmencita as well, and hopefully we'll be able to come back to this. I'm really sorry to interrupt you, but I think the important point that you're saying in terms of how, certainly in a country where rare diseases is terribly under-recognized, even as you're bringing in health therapies, and the importance of having this kind of support. I just want to pivot over to make sure we have enough time before we close over to Carmencita Padilla, who has for a long time been the champion in the Philippines in terms of advancing rare diseases, and has certainly made major inroads in a country where I think it's an example to many people where Philippines does have a policy on rare diseases and does support it. But Carmencita, you've also not only made a real impact in terms of the Philippines, but serve as a bit of a model across the Asia Pacific region. And so what do you think this impact of a UN resolution would be for rare disease policies and practices, certainly in the Philippines, but what do you think it might mean to other countries, especially in Asia Pacific?
Well, thank you, Duran. It's when I look at the UN resolution, it's not really just for me, but actually for all the countries at the low and the middle income countries we're in, rare diseases are not a priority in the rank of the Ministry of Health. So I do have two legislations. I've got two laws, actually. The newborn screening law has been very successful, and it has covered the rare diseases. But my rare disease law is struggling. And as Anders earlier said that this can be the door. I look at the UN resolution now as a door opener. When I say a door opener now, I'm going to bring this resolution to the Ministry of Health and tell them, look, I waited so long, here is a resolution, and it's going to put some peer pressure, some policy. It's at the level of the high level saying that if other countries can do it, then we can do it. So I really am looking at the UN resolution as a, when I was listening to all the sharing, I am going to consider the UN resolution as like a bullet train, a speed train, a sonic jet, so that I arrive at my goal wherein no one will be left behind. I'm a geneticist and I struggle with diagnosis and treatment, so I can sympathize with everybody. But to all the countries, this resolution is going to be a medium. It's going to be a message to the ministries of health that we have to make sure that we address them. So thank you for this resolution. Thank you very much.
Well, it hasn't happened yet, so we need you to continue to fight to make sure that we do have it happen, right? But with this kind of support, I'm going to just pivot back to Todd. We only have about a minute left. So Todd, I'm going to put you on a really hard spot. You've heard what the community has said in terms of their hopes for the resolution. What advice would you give to, our people on the ground here in terms of, if we have this resolution, what would be the first thing that we should be doing with it?
I think first and foremost, it's important to use all different forums that you can. You have already the general framework in terms of human rights, the SDGs that you can use, but what you're looking for is that recognition, that visibility within the UN system, that you can then go back to the member states and say, look, the interpretation is that rare diseases does relate to leaving no one behind. The rare diseases is important to understanding the concept of disability. You have many forums. Even within human rights, you have multiple committees. And I would encourage that you continue to push and you continue to get the types of statements that can help you in your domestic context. Because in the end, it's about education. Because rare diseases is just that. It's rare. And so you need to see that combination, that where you come together as an association, bringing that awareness to the policymakers to say, no, your policies actually affect us as a collective. And through that, look, we have this resolution, we have this statement, and that we really encourage you and then work with them to make sure that the policies are created, take into consideration the rights and the rights holders.
That's really powerful. And I know that you live what you say, because your door has always been open to us. So the support that we've had from your office and certainly your participation here is just such a huge testament to, I think, the kind of support we've gotten from the UN. So, I mean, it's a challenge to us, right? Let's live up to that, and let's take advantage, as Todd says, of the opportunities that are going to be there. It's a lot of work for us, but it does create that door. So thank you again so very much for everybody to being here. I am going to pivot in very quickly to Jan Lekam, who, as all of you will know, is one of the champions in terms of rare diseases globally, and has certainly been, I think, a huge driving force behind the UN resolution and all the work that we're doing there. So very fitting that we had opened with Anders and we're going to close with Jan.
Thank you very much, Durain. I think it's fantastic to hear what we heard today. And what we heard is first the call from civil society and from this rare disease community globally for a UN General Assembly resolution to address the challenges of persons living with rare disease. And we heard for the first time, loud and clear, the reply from the UN member states through their ambassadors to the UN, and also from UN officials with us today, and I thank them very warmly. We heard what? We heard, one, that they recognize the needs and challenges of persons living with a rare disease. They express their strong support to the cause and to elevate the issue in the UN system. They are committing to lead, to work together, and to promote a UN resolution. That's fantastic. Now, if I'm able to share my slide, sorry. Yeah, I hope it works. Yes. This resolution, what we heard today, will be the vehicle to express the respect of fundamental rights for a category of persons which are particularly vulnerable and cumulative vulnerabilities. So that works for everyone here online in their respective territories and respective diseases. What everybody agreed on was to say that it's a holistic approach, a 360-degree vision of the life of people living with rare disease in all aspects of this life, in order to move from invisibility to visibility in society, to move from indifference to the hospitality of society, to welcome people who are different persons, who have different needs and requiring some special attention. And also a fraternity to care for people who may have different needs. And that is social inclusion. And to move from ignorance also to awareness, that was mentioned several times, knowledge, reducing inequalities, reducing discrimination. So this UN resolution will be useful and benefit beyond the 300 million people affected by a rare disease. It will also benefit their families. It will also benefit more broadly people living with disabilities or impairments. After this COVID-19 pandemic, the persons living with a rare disease are particularly exposed, impacted, isolated, suffering. That's what we get from all over the world, even in Europe. So this UN resolution, as it was mentioned, can help build back better an agile, resilient, strengthened society, and in particular healthcare system. But also it's a way to have a genuine implementation of the Universal Health Coverage political declaration adopted by the UN in 2019, and also a genuine implementation of the Sustainable Development Goals to leave no one behind. Leaving no one behind is all about us and about rare. So now let me show you this indicative timeline. On the left, you have the civil society proposal. So all the work, the mobilization that has been done during the last year to develop this key ask, and what do we mean behind this key ask? What kind of actions could be envisaged to create a positive change? Today, it's the blue box where we have the Rare Disease Day, Rare Disease International Policy event of the why a UN resolution and why now. And I think we addressed this question today. Now, next is the blue box below. It's about the member states coming together to take action. And this is called the core group. And you heard today these countries, through their ambassadors, speaking to say, we're gonna support you for that. We're gonna take it to the General Assembly. So this core group, as for today, is composed by Qatar, Brazil, and Spain, taking a strong commitment. We hope in coming days to have confirmation of France and Thailand, who are strongly supportive, but have not yet confirmed from their capital city that they can be in this core group. This core group will meet in the coming days. I would like first to thank Spain and the Ambassador Santos Maraver today for his strong support, but also because Spain has supported us all along, and they have given us the strength since last summer to dare to move on. Also, I would like to thank Qatar and the Ambassador Al-Thani. Ambassador Al-Thani is the person who came back to us in August and say, let's do it. It's the COVID pandemic, but let's do it. You must be part of the answer to the crisis. So they have encouraged us to take the challenge during this pandemic, and they will lead the process with the core group. I would like to say thank you to France and the Ambassador Rivière and his predecessor, Ambassador Deladre, for their strong support and advice all along also, and for the link they are making with the group of member states in the UN General Assembly on global health and foreign affairs. I would like to thank Japan for their strong support on UHC and inclusion of rare disease in UHC, and particularly today to the Ambassador Kimura. We count on Japan to support and be a supportive member in the rest of the process, as they have expressed. We would like also to thank Thailand and His Excellency Ambassador Shrivi Hok, who have attended the last meeting 2019, has supported us to have rare disease into universal health coverage, and you heard him today committing and supporting for a UN resolution. And that's why we hope that they will accept to join the core group. Would like to thank also Brazil. Brazil has been one of the sponsors of the previous events, and Ambassador Costa Filho made a very strong commitment today to you also. We hope they will join this core group, and also we play a key leading role into it. With this, I would like also to mention other countries which all along our journey have helped us to navigate through the UN system and elevate the cause of rare disease. Estonia has been the sponsor of the NGO Committee for Rare Diseases and of previous events. Sweden has been extremely supportive all along, and Queen Sylvia personally particularly committed. Malta also, and you heard today William Buttigieg speaking and Michel Muscat supporting from Malta. Kuwait is a strong support and advisor of this process, and you heard today Tarek Al-Banai for what he said in 2019. United Arab Emirates and the Ambassador Lana Nusseibeh, who have been extremely supportive in 2019, and I hope they will be part of the rest of the journey now. Serbia, Uruguay, and Czech Republic also have been committed in the past or are planning to commit. Now, the next step that you see here is that we need to bring more supportive UN member states for the different geographies and the different economies and the different political groups within the UN General Assembly. So today we are many online, and I'm calling particularly to colleagues, friends or new friends in Africa, in North Africa, in Southeast Asia, in Latin America, to contact us, because we need you, not only the members of Rare Disease International, but you may be a professional, you may be someone who have access in your country. It's the moment we need you. It's between now and next month. We need you to contact your Ministry of Foreign Affairs. We need you to contact your Ministry of Health, maybe the Ministry of Research, and we need you to contact your permanent mission in New York for your country. And together we'll coordinate the efforts with Rare Disease International, but also with the core group of member states. This is how we're going to build the momentum of more supportive member states in the coming months. So you have the core group working on the draft, negotiating, and then we move on to a larger group of supporters. And we go back to the next box in the purple here part, where we will have another event which will bring along the supportive member state and where the draft will be presented and discussed. This will be later in May. And we hope that at this moment, after that, the core group of member states with the supportive member states will feel that the maturity is good enough to move on toward the UN General Assembly. So I hope that was clear in terms of next step and what to do. It's the moment where everyone has something to do in the next 8 weeks. Thank you.
Thank you very, very much, Jan. For those of you who are concerned that you haven't been able to see as clearly all of the slides as you want, rest assured you will get the materials. And indeed, we will also be sending you some additional materials in terms of a toolkit that you can use, because as you can see, it is so important that you are engaging your country representative, your member state, to support this resolution. And really, they will listen to the people that are in their countries. They will listen to us as that rare disease community. So if we don't speak up, we're not going to be able to get the support that we need in order to push this through. Huge thanks. I know that we're just beyond time, so I do want to wrap it up. Certainly our huge thanks to Ambassador for staying on with us, to Ms. Nabi for her kind words and for staying with us, and certainly to Todd Holland for coming in from the Office of the High Commission of Human Rights. It's really such a tremendous support to have your presence here, but also for what you do behind the scenes. We are so very grateful to everybody from the community for having joined us today for this. I think we had well over 220 people that took part in this forum. So we know that the international community is really very much paying attention on site. And we also want to really thank all of the people that have been working with us in terms of addressing the member states, bringing the attention to the different members of the UN for this very important resolution. It is now over to us to actually advance this. You've heard from Jan, you've heard from Anders. They've actually laid the groundwork for us. They've actually created for us the opportunities to go out there. I would like to thank the team here, to Flaminia, to Clara, and also to many of the other people that have been supporting them in the work that we're doing. It's absolutely amazing, the volunteers. But now I say again, it's over to us. If we don't do our part, all of this will be for naught. This is an important year. We all know that. We've heard the benefits of it. And I know from the comments in the panel that have been coming in from the participants that you feel that as well. And you do recognize that this is a huge opportunity for all of us. So who knew, that when we set up the NGO committee, that would be at this point today? Well, I think Anders and Jan probably knew. I think that was always in their hearts, and they were not going to let this go. So they've taken us along with them, and they have provided the leadership to make this happen. It is up to us now to make sure that we do our parts and to follow through, because we all know, as Avro so very strongly said, as Samuel so very strongly said, what, having this as a resolution will absolutely help us in the work that we're doing, and certainly very much for Dr. Padilla for what she's been saying in terms of how she will be able to take this back and to actually use it to strengthen the mission that she has been on for the last number of years and getting that strong support from the government. I remember asking Carmen Zita at one time, how do you do this in such a challenging political environment? And I think it's no mistake to say that many of us have challenging environments, but especially in the Philippines. She says, we just keep our eyes focused on those people that are supporting us. So if our Minister of Health is supporting us, if we have the right kinds of support, we drive this through. So this is one more, arrow in our armament. So we need to make this happen. This will be a huge opportunity for us. So thank you to everybody who attended, to participate. Thank you to everybody for putting this together. This is absolutely the most wonderful way of celebrating Rare Disease Day this year in this really challenging times. But as we know, and it's not very trivial to say, when tough gets going, this is kind of where, we kind of, when going gets tough, this is kind of the opportunity for us as the tough to really push through. So we're not going to let this opportunity pass. So huge thanks to everybody, and certainly have a good day, have a good evening, have a good night. I've seen people here from Australia. I don't know why you're hanging in with us at this hour, but thank you and bless you for being here with us. Thanks to everybody. Bye-bye.